Well, Danny, thank you for joining me in this discussion on the relationship between the patient and the osteopath in their clinical context. I wonder if you could tell me what are some of the common issues that not just come your way, but come your way and cause you to feel a little dis-ease or unease in the presentation by the patient?
There are a few issues that can do that to me. Two come to mind. The first one that comes to mind, I would say, is the immediate awareness that the symptoms that the patient is presenting with don't fit a typical clinical picture, and therefore there's probably a deep psychological cause for it. So that can cause me dis-ease because I'm sitting there with a patient and I'm taking a case history and I might be thinking to myself, this doesn't really sound like something directly relevant to osteopathy. They need more psychological help. And how am I going to deal with this? Am I going to say to them, this isn't for osteopathy? In which case they'll probably be a bit put out because it's a physical pain. Or do I go along with them and treat them as if this is just a physical problem in the hope that by giving them the care, it'll help the problem. Another problem that jumps to mind or that causes me dis-ease is that sort of response from a patient of, hasn't really helped me very much. The feelings of failure or the feelings of that you're going to fail. Sometimes you can tell with the patient that whilst you're treating them, you're not going to be able to get them better, and the worry that might cause, that causes whilst treating them.
So why would you be troubled by these issues? After all, you might just tell yourself that they've come to you because you're an osteopath, therefore you're going to go down that road and ignore the emotional, psychological. What interests you about the psychological, emotional side?
Well, I would say the easier patients are the typical orthopedic patients. The typically orthopedic patients. A patient comes to you with shoulder pain. They're clearly restricted in their range of movement. There's an obvious cause for their problem. So the treatment is going to also be clearer. This is what we need to do in order to improve the muscle. The other case is what causes me difficulty is I'm going to have to use a lot of different tools here. I'm going to have to get on the right side of the patient, manage them well, and I mean from an emotional point of view, manage them well. And there's a strong chance that I won't be able to get them better because there is a strong emotional component to it, which they seem to be holding on to.
Okay, so what you seem to be describing is what we call, in psychological terms, resistance.
Okay.
And so you're suggesting, it seems to me, that quite early on in the consultation, you're picking up some resistance on the part of the patient, which is partially related to the presenting problem. It might be related to something else. And you develop a kind of detective-like interest and curiosity. What else might this mean? Is that your experience?
What else might this mean? Yup. There's also, my association to what you've just been describing is also often it's accompanied by a sense that the patient doesn't think you can succeed.
Right. So almost, again, early on in the consultation, you're picking up the patient's sense of despair or negativity, or even in some cases maybe hopelessness, that I'm coming to you, but I don't really believe this is going to help me.
Right. And often it's accompanied by a long history of other practitioners treating them. And sometimes in the phone call, we'll say the same thing. At which point I'm thinking to myself, if that practitioner hasn't been able to help you, and that practitioner haven't been able to help you, and they are also manual treatments, what makes you think that I'll be able to help you?
Right. So let me ask you rather brutally, why don't you just dismiss these patients?
Dismiss them as in not treat them?
Yeah, send them away. Or politely say, you're not, you don't,
this isn't the right discipline.
This may not be the right treatment for you.
Sometimes I have done that.
Right.
But often there's a question in my mind. Maybe there is a real physical factor. Let me meet them first. And secondly, maybe there is a way that I, as a practitioner, as an osteopath, can also help them overcome the psychological problem, or help them ease them through that.
I guess that you must also be wanting to live up to the ideal of what we call holistic treatment.
Yeah.
So you recognize that the patient is made up of many parts, including the one that's being presented, but there are also others, and that you might be helpful in addressing both.
Yeah, and also I don't want to come across as a failure as a practitioner. I want to be able to see if I can treat them.
Right.